Ladies and gentlemen, esteemed participants, and healthcare enthusiasts, I extend a very warm welcome to each one of you to our very highly anticipated webinar. Today, we are fortunate to explore functional medicine with a renowned speaker who possesses a wealth of knowledge and experience. I am delighted to introduce Dr. Anish Musa, an accomplished ophthalmologist with an impressive 25-year-old journey in the field, coupled with a certification in functional medicine from the esteemed Institute of Functional Medicine. Dr. Musa serves as the guiding light at Ultra Wellness Clinic, a pioneering institution that specializes in an array of health concerns, including metabolic syndrome, hormone health, mold toxicities, gut disorders, and autoimmune diseases. Recognizing the limitations of conventional lab ranges in accurately diagnosing the dysfunctions, Dr. Musa embarked on a remarkable journey to bridge this gap. His dedication led to the creation of functional lab analysis software, a game changer in functional medicine. This groundbreaking tool translates lab reports with optimal ranges, providing practitioners a worldwide and comprehensive diagnostic approach. Dr. Musa firmly advocates tackling the very roots of chronic diseases rather than merely addressing the symptoms. Drawing the powerful principles of functional medicine, he highlights the importance of personalized care. He understands that each person's genetic makeup and physiological composition are unique, require tailoring strategies for optimal health. So, as we begin the enlightening journey, Dr. Musa will reveal that how a classic case of insulin resistance can be looked upon by three different approaches: one by an allopathy doctor versus a nutritionist versus a functional medicine approach. So, without further ado, let us extend a warm welcome to Dr. Anish Musa for gracing us with his amazing insights. Over to you, sir.
Thank you very much, everybody. Warm welcome and namaskaram to all. Thank you very much, Krishna, for introduction. And see, before I can start and jump on teaching you about functional medicine and what functional medicine can do, I would like to start with my own journey. As Krishna said, I am a happy ophthalmologist 10 years back, and I'm doing my surgery, and that was great, fantastic, everything was fine. But I was diagnosed with IBS, and that has changed my life. I'd moved from one doctor to another doctor. I wake up with the morning with an abdominal pain. I'd done a colonoscopy many times, but I didn't find out anything. So that chronic condition, IBS, maybe you are suffering, and maybe your patient is suffering, and that is a part of life. But eventually, I started with an body pain, chest pain. I done a multiple time echo and ECG, and didn't find the solution. Then life goes like that with many chronic conditions. And then eventually, in conventional medicine, when the patient complain one symptom again and again, then usually we diagnose as a depression. So I end up with a depression. So I would like to know that is my journey. And then one day doctor prescribed me antidepressant, SSRI. But from my heart, I know that I could not be depressed. There is something else going on in my body. And that was the waking call for me to explore out of box, to find out the real cause of my health condition. So I started my journey 10 years back regarding researching about what could be the possible cause and what is the possible things that we can explore in a functional medicine. So I end up with an functional medicine, and 10 years back nobody know about the functional medicine. So I find out the best institute that teach the functional medicine, IFM, and I started changing, learning, applying the principles of functional medicine in my own health, and I got a very good result. So from that onward, I moved my practice from ophthalmology to functional medicine, and then my passion started to teach functional medicine, treating the patients and families, and that's how I started my journey as a functional medicine expert and functional medicine clinician. So with that story, I would like to teach you same what is functional medicine and what is the cause of Hello, Krishna, can you hear me?
Yes, yes, sir.
Yeah, sorry for interruption. Yeah, let me share my screen. And hope Krishna, you can see my screen, right?
Yes, yes.
Okay. So let me explain you what is not the functional medicine. As we know, we in India, around the globe, we are having a tsunami of chronic disease. So functional medicine is stand for chronic conditions. I'm not saying that functional medicine is alternate medicine. Many people see that functional medicine could be the alternate science or integrative medicine or something else, whatever the name you want to give. But here I want to say you that functional medicine is a core operating system that will change our thinking, and that's what functional medicine is meant for. Functional medicine is not meant for acute conditions. Functional medicine is for all kind of chronic conditions. So before I can jump on teaching you functional medicine, let's explore what is a chronic disease burden in India. So you know about the chronic disease, but I would like to show you some data over here. If you look at the data science, then ICMR says that 11% of Indian population, they have diabetes. 11%. If you count the pre-diabetic condition, then 15.3% of Indian population is pre-diabetic right now. So if we compound the one disease, the diabetes or pre-diabetes, it's a part of metabolic condition. But if we count that, then 25% of Indian population right now in India, they have a sugar irregularity. If we include hypertension, then look at the national survey. 24% of male having an hypertension. WHO says that out of 4 adult people, you will find out one person having a high blood pressure, and 21% of women they're having an hypertension. So if we combine the pre-diabetic changes or diabetic or sugar irregularity, and we combine hypertension, then almost 50% of Indian population, they have some kind of blood pressure and they have some kind of sugar irregularity. Just two diseases, diabetes and hypertension. And if I include thyroid, look at this one. And this data is old, before COVID. 20% of population, they have abnormal thyroid function. Either they have overt hypothyroidism or they might be having a subclinical hypothyroidism. So look at the data. So if you meet 10 people in a day, out of 10 people, 8 people having either they have hypertension, diabetes, or thyroid irregularity. Just think about Indian population and think. So if you incorporate these three data, then it's clearly said that 50% of adult population, they have one chronic condition, and 25% of population, they have more than one chronic condition. So look at the data, what we are doing in conventional medicine or whatever the else medicine we are doing. But this is something serious and we have to focus on that. So what functional medicine is not? Functional medicine is not for acute disease. We are doing best thing in acute condition. In any kind of emergency situation, let's say if somebody having a chest pain, we are doing the best diagnostic tool. We do ECG, we do angiography or angioplasty, but we can save the life. So for acute condition, we are doing the best things, and that is our acute care model. We are not talking about that things. It means functional medicine not against any medicine. Whatever the medicines or whatever the practice you are doing, that's great for acute condition. That great for infection. That great for symptomatic relief. And we have many surgeries that can help and they can save the life. So we're not talking about the acute condition. We are here talking about the chronic condition. And as I explained you, chronic condition, that symptoms or that disease lasts for more than 3 months or 6 months, that we consider as a chronic condition. And these are the chronic conditions that already I told you about: diabetes, hypertension, thyroid, IBS, depression, and so many diseases are there. They consider to be a lifestyle chronic condition. So functional medicine framework is pointing a solution or giving you a framework that can help you reversing the chronic condition. Even you can understand the chronic condition in better way, and that will help you to reverse the chronic conditions. Let's give a simple example. What is our acute care model, and what is the thinking process behind that acute care or conventional medicine model? See, in conventional medicine model, when we look at any kind of symptoms, our thinking is linear. We want to find out that one cause for that one condition. For example, let's say a patient walked with a fever, we are thinking, we want to find out that infective agent. That may be a virus, that may be a bacteria, that may be a protozoa. So we want to find out that one particular cause. If the patient is entering in the clinic with the chest pain, we want to find out that one particular cause for that chest pain. So that is a one-to-one relationship, and that is our linear thinking. We want to find out the one cause for that one particular condition. That thinking is based for the acute condition because we are dealing with that emergency acute situation, and that's fine. We are doing the best thing over that. But when we have a chronic condition, just for example, let's say if somebody having a depression, it may be because of low thyroid function, it may be because of pre-diabetic condition or diabetic condition, it may be because of IBS, or maybe because of gut dysfunction or antibiotic uses, or omega-3 deficiency or vitamin D deficiency. So here we are thinking that one condition or one disease, there may be a multiple cause. And we want to find out what are the causes for that particular patient. Maybe your patient of depression doesn't have diabetes, but he might be having a low thyroid function. A patient doesn't have omega-3 deficiency, but he might be having deficiency of vitamin D. So we want to find out the causes. What are the causes and what are the factors that affect in that conditions? On the other side, you can see one pathology or one mechanism, let's say inflammation. So inflammation in one patient can lead to heart disease. As you look at the CRP or inflammation increase the risk of cardiovascular disease. So inflammation can lead to the heart disease. That same inflammation can lead to the diabetes in some other patients. Same inflammation can lead to a depression in some other patients. Same inflammation can lead to a cancer in some other patients. So I just want to make you understand that linear thinking will not work when we want to understand the chronic conditions. And that's why we want to understand, and we require a different mindset, different thinking, different roadmap, different tools to understand this chronic condition. With that thing in mind, functional medicine is actually a foundational science. It's an operating system where you think about chronic conditions, where you want to find out the root cause of that particular chronic condition for that particular patient. So it's a biology-based approach where we want to find out the root cause of the disease, and we want to apply the science of lifestyle. We want to work on a food, we want to work on a lifestyle, we want to work on nutrition, and we want to work on medicines because they're also important. So that functional medicine, so I will explain you the clear-cut model of functional medicine frameworks